Shemai, my name is Rosie Mellors. I am one of two shared network managers supporting the relationships and stakeholders involved in running the School Health Research Network. My focus currently is on supporting the network as it expands into primary schools across Wales. In this video, I will be giving you a whistle-stop tour of what SHRN is, how to get involved, and the benefits of being involved. The School Health Research Network, or SHRN, is a network which brings together schools, researchers, Welsh Government, Public Health Wales, and education consortia to improve young people's health and well-being. We do this by providing robust health and well-being data to schools and national and regional stakeholders, producing high-quality school-based health and well-being research for Wales, generating new evidence on how best to improve young people's health and well-being in the school setting, and helping schools and those who support schools to understand health research evidence and how it can be used in health improvement. Currently, the network includes all state-maintained mainstream secondary schools in Wales. These schools complete student and school level surveys every 2 years to provide a regular snapshot of 11 to 16-year-olds' health behaviours and well-being. This survey touches upon relevant health topics including healthy eating and physical activity, mental and emotional health and well-being, smoking, alcohol and other substance use, and sex and relationships. This data is used to create 3 types of report: national, local authority, and school level reports, which can be used to develop a proactive culture of health improvement in schools. The network also provides schools with access to resources to support health improvement activities, such as research briefings, interactive online data, webinars, conferences, and evidence-informed resources. The SHRN team have been working on the expansion of the network into primary schools since August 2020, when Welsh Government provided funding to scope the feasibility and develop a model for SHRN in primary schools. This work was originally conducted with Year 6 pupils, but was later expanded to include the whole of Key Stage 2. Research was completed to pilot the questionnaire to ensure questions are pitched at the appropriate level, and consultations were carried out with key stakeholders to refine processes relating to consent. In autumn 2022, mainstream primary schools from 4 local authorities were invited to take part in the current survey, and this invitation has now been extended to the rest of Wales to take part in the survey by the 31st of March 2023. The current primary SHRN Health and Wellbeing Survey collects data on students' demographics and outcomes, including mental health, subjective wellbeing, school transition, bullying, wider health-related behaviours, and school connectedness. Survey items are filtered according to the child's year group. Copies of the survey are available for you to view on the SHRN website. The data collected using this survey will be used to create school-level, local authority, and a national-level report. Each bespoke school-level report will highlight the school's data in the question areas and provide accompanying information on guidelines and links to best practice. The report is intended to help schools track, monitor, and plan improvements in pupil well-being, identify key health and well-being needs from the data collected using research-validated measures, enhance school development plans, plan and enrich the curriculum, for example, in the health and well-being, science and technology, and mathematics and numeracy AOLEs, develop targeted healthy school initiatives, engage all members of the school community with the health needs of their learners, better understand and support events such as transition to secondary school, and deliver and evaluate the whole school approach to mental health and well-being. The national report will be available by July 2023 and can be used by schools to compare their own school report data to national benchmark data. Local authority level reports will be created where there has been a sufficient number of schools sign up to take part in those local authorities. Upon receiving these reports, schools are encouraged to work closely with their Healthy Schools coordinators for support on how to productively use their SHRN data to support health and well-being improvement in their school. We are aware that schools are currently being asked to take part in a number of surveys which approach health and well-being data over a range of different topics. Only you and your colleagues are able to make the decision on which survey is right for the needs of your school and learners, but there are a number of benefits to taking part in the primary SHRN Health and Wellbeing Survey, including SHRN is the largest national network of its kind in the world and is the only health and wellbeing research network which integrates both primary and secondary, enabling joined up working across sectors and considering data around transition to secondary schools. The survey research The survey's research-validated data helps self-assessment and identifying key health and wellbeing needs, aids the school in development planning, and enriches the curriculum and informs healthy school initiatives. SHRN school reports contain chapters on how to interpret the data, advice on using an evidence-based approach to learner health and well-being, as well as a directory of non-profit organisations who can help and support you. SHRN surveys are cited in both Welsh Government and SDin guidance and can play a central role in the delivery and evaluation of the whole school approach to mental health and well-being, and it is completely free of charge to take part. So hopefully you're interested in taking part. If you are, I'll now talk through how to sign up, prepare for, and run the survey in your school and what happens afterwards. By now, all mainstream primary schools in Wales have received an email invitation from our research team. This may have gone to the wrong person, as many were sent to generic inboxes, so if you haven't received this, you can get in touch with us. I'll provide contact details at the end of the video. If you email our team to take part, you will be asked to complete and return a signed research agreement, an example of which is on screen. This agreement outlines what taking part involves and asks for the details of a Key Stage 2 teacher who will be our main contact for liaison going forward. And it also asks for the date you plan to run the survey. Once you have returned the research agreement, you will receive your study documents. These will include an information sheet for you to send to parents, an example of which is shown on screen. You will also receive a step-by-step teacher guide for the day you complete the survey and an annotated copy of the questionnaire for teachers. Your first step on receiving this information is to send these parent information sheets to all parents and guardians across your Key Stage 2 year groups, as parents and carers need to have this information a minimum of 2 weeks before you conduct the survey. This is so that they have enough time to consider the information and opt their child out of the study should they wish to. We kindly ask that you collate all or any opt-out communications and you keep that for yourself to one side. Next steps are to look through the teacher instructions. This is your teacher guide. It is useful to circulate this to all teachers who are supporting learners in taking the survey. It is a step-by-step guide for on the day, but it is useful for teachers to have this information in advance. Within a week of your survey date, the research team will send you your link for the survey. Each school receives a single link, and we ask that you complete the survey on the date that you put on your research agreement, which should be within 2 weeks of your parent opt-out cutoff date. On the day that you are conducting the survey, you will need to allow around 20 minutes for completion. Some things to ensure your survey day are learners who have been opted out should be provided with an alternative activity. Wi-Fi is required for the survey, and each learner will need access to their own computer or tablet, and each learner will access the link that has been provided to the school individually. On the screen is what the learner will see when they access the survey. As you can see, the learner can access the survey in either English or Welsh. Next will be the pupil assent page, where we will ask the learner whether they are happy to take part in the survey. There is more information around this in the teacher guide. For students who click the green button to take part, they are asked their year group. This is very important as the survey differs depending on their year group. Again, more guidance and information on the different questions relating to year group is available in the teacher guide. With regards to the rest of the questions, all questions have a I do not want to answer option. All questions are multiple choice with the exception of one question which has a free text box. This question is the question around what language is most commonly spoken in their home. The final page of the survey displays a finish the survey button which submits the data once clicked. We ask that you ensure that each survey completes the survey once only. Following the completion of the survey, we ask you to ensure that learners are signposted to any health and wellbeing support in the school that is available to them. More information on this is in the teacher guide. We ask you to let us know if there were any logistical problems, for example with Wi-Fi or the survey crashing, and we will be in touch with your bespoke report following the analysis of your data. So that was a whistle-stop tour of the primary SHRN survey. If you have any questions, comments, or queries, please do get in touch with me. Or if you would like to sign up straight away, get in touch with the research team using the details on screen. We look forward to working with you in the future.